take a look real quick at how drugs affect the nervous system in a couple different disorders of the nervous system. To begin, we're going to look at psychoactive drugs. Psychoactive drugs have the ability to cross the blood-brain barrier and as a result have an effect on the nervous tissue. They work by affecting the release, the action, or the reuptake of a neurotransmitter. For example, cocaine is going to block the reuptake of dopamine. Dopamine is a neurotransmitter that gives you what I call your feel-goods, their euphoric feelings. As a result, if you flood the synapse with dopamine because you don't reuptake it into, say, the presynaptic neuron, you're going to continue stimulating that postsynaptic neuron, which is going to give the body a high or the euphoric feeling. If you should take a psychoactive drug, you could develop what's called psychological dependence. This is the belief that you need the drug versus physiologically actually needing it. Another issue with psychoactive drugs is tolerance. Tolerance is when one needs to use more of the drug or take the drug more frequently to achieve the same high. What happens in the event of cocaine, for example, is that your body tries to maintain homeostasis. And when given cocaine and the dopamine is not taken back up into the presynaptic neuron, the body kind of panics and thinks, wow, we produced way too much of that stuff. And so it stops producing it. And so what ends up happening is that you need to take more and more of the drug to get the same high because your body isn't releasing the dopamine it used to. You're artificially putting this drug in that gives you that feeling. Of course, this is also going to lead to addiction. This is when one needs the drug in order to feel normal. So in the event of cocaine, for example, let's say that you were addicted to cocaine, your body would stop producing dopamine. And in order to dull the pain, let's say, of everyday life, you would need to take the cocaine. And so there is a situation where people who are addicted to drugs are not taking the drug to get high, they're just taking it to feel normal, so to speak. Addiction is then a drive to obtain the drug despite better judgment or good intentions. So you know it's wrong, you don't necessarily want to do it, but you are in fact addicted and it has a hold on you. If somebody is addicted to a psychoactive drug and they stop taking it, you'll have to go through what we call withdrawal. This is a symptom that occurs when the drug is suddenly removed. Some drugs can actually cause harm or death if just stopped, say, cold turkey, for example. And that's because the body does get so dependent on them that sometimes they almost need to be weaned off of a drug. The next thing I'd like you to look at are some of the disorders of the nervous system. These are, again, some of those that you're going to be studying on your own. You will be responsible for some of the different disorders in the textbook. Those disorders begin on page 265.